My name is Esperanza Castillo. I work as a preschool teacher. I was waiting for the light to turn green when I felt a sharp pain, and then it gradually spread into the worst headache ever. I felt really dizzy, nauseous, weak.
I have been working at RMC since the day that Santa Clara Valley Healthcare took over operations of this hospital, since April 1 of this year. I first learned about Esperanza's case from a phone call from one of my colleagues in the emergency room. I was able to see immediately that she had some very concerning bleeding in her brain. A third of patients with this kind of bleeding die. Esperanza's own mother had died of this exact same condition about 15 years before.
I was scared to fall asleep. That fear comes from just similar situation that happened to my mom. She was complaining about a headache. She fell asleep and she never woke up. My biggest fear was leaving my daughter alone because my mom had left us, and that was very difficult for me to not have a mom at a young age.
Esperanza's condition is amongst the highest risk conditions we have in medicine. In this case, a ruptured aneurysm. We were able to treat Esperanza's aneurysms using what are called endovascular technique. I use a needle to enter the artery in Esperanza's leg. Once near the aneurysm, I use a microcatheter to very gently introduce a coil and to fill that aneurysm with that soft metal loop of wire. The technologies that allowed me to take care of Esperanza don't exist at every hospital. I'm very proud that Regional Medical Center is the only public hospital in the region that provides these services, and to live in a county that values those services and its residents.
When Dr. Kansagra came in, it was the next morning. He mentioned what had happened to me. I made the connection to my mom. I was shocked just because I didn't know it was a genetic situation.
It is a big deal to be able to provide care near patients' homes in the communities where they live. Our patients don't have to go an hour or 2 hours away to receive this care. Being removed from their families, being in a place where they don't have that important support. My team's commitment comes from a deeply ingrained sense of wanting to help this community. And they know what this hospital means to the people that it serves.
What I liked most about the RMC staff was that they were willing to make me laugh, to make me feel better.
Her daughter's outcome is that her mom is around to see her grow up, and her mom is around to be there for all of life's important moments. It is vital that our patients feel comfortable seeking that care in a way that they do at regional medical centers and other hospitals of Santa Clara Valley Healthcare. There's a very high chance that she would actually not have survived this condition without the timely care. In 2026, federal budget cuts to Medicaid will take effect, creating a more than $1 billion shortfall to Santa Clara Valley Healthcare over the next few years.
I have Medicaid insurance, and these cuts would impact myself and the community.
Our hospitals are under unprecedented financial stress, and without your help, more lives than ever will hang in the balance. Inspired by these challenges, Santa Clara Valley Healthcare is working harder than ever to streamline care across all of our hospitals to provide services in the most efficient way possible, but we can't do it alone.
I think it's important to donate to Valley Health Foundation because they support hospitals and patients like me.
All contributions are invested directly into the health of our community. With your donation, you can help us save our local hospitals.